go over our Let's Talk NCLEX question of the week. Hi, everybody. You guys are coming in with answers. This is Let's Talk NCLEX. So we're going to go over our question of the week. And of course, as we always do, there are more topics that we want to review quickly before the weekend comes in. I have the pleasure of being with you guys once again. I am Regina. I'm the NCLEX instructor here with ReMar Review, where we try to do everything we can to get you all prepared for your NCLEX exam. It is a process, it is a journey, but it is so much easier when you're able to have assistance in the process, and when you're able to see and hear from others who have done it before, which is really cool. Here's the website. Here is the website, remarreview.com. It is where I'm able to connect you guys to the products that help you to study and make you feel more confident on the difficult subjects of nursing. And I am so happy that you guys are with me here from California. Maria is from Maryland. I just see you guys shouting out, saying hello. Maria is here. I have a Marie and I have a Maria. Every Friday, we come on here with hundreds and hundreds of nursing students that are ready to pass their NCLEX exam. And the testimonials just come in. So let me tell you, this question, our NCLEX question of the week, has been a controversial one because I was just taking it back to the very basics. And the question was simply on, I won't say it, I'll read it. I'll read it to you guys. I'm here at the ReMar Review location. And as we get people to come in to the broadcast, I just want to let you guys know that this is the year where the NCLEX RN coming up in 2019. So we're transitioning coming up into 2019. They are expecting to release some changes to that exam. So there's actually going to be a big event and a big release. And I'm hoping that we'll all be ready for those changes, no matter what they are, what the exam is going to say as far as questions go. We know the content's going to be the same, right? But the questions as far as they go, we want to be ready to bring you that information. But how about we talk about the current NCLEX and ways that you can pass that current NCLEX exam? So I want to actually, I have the pleasure, good afternoon, I have the pleasure of bringing to you guys somebody who is extremely valuable to the ReMar nurse community. And the reason why she is so valuable is because she has a testimony to share, and it is an amazing one. I am really honored that she took time out of her busy schedule of being a nurse now to come and give back to the community. You guys will be familiar with her because I did her story right here on a Monday Motivation. Her Nurse Elizabeth. I mean, I am super excited. She's here for faith. She's here for inspiration and motivation. But everybody say hello to Miss Nurse Elizabeth. She has here Addie, but I'm just going to call you Nurse Elizabeth. Say hello to your ReMar nurse family.
Hello, everyone. Hi.
Perfect. Hi, how are you? Thank you so much.
Good. How are you?
Okay, so I have you on here. I don't want to keep you long, but I wanted you to kind of introduce yourself and give us a quick rundown of your NCLEX history, like your NCLEX history. Right on.
Okay. Okay, so I graduated 2013, and then when I first took NCLEX, honestly, I didn't really know a lot about NCLEX because I was just more focused on school. So when I did graduate and everything, I had to like do a little research. So I went with one of the popular programs. So I did that, and it cost a lot, but I did not pass, and I tried something else. Like the first few times I didn't pass, I was like really down and like devastated about it. But over time, I kind of like started to think like what was it that I was missing, because it's not like I didn't have any common sense or I didn't know what, the information was or what I didn't learn. It was more of what was I missing as far as this NCLEX, like this exam,
Yeah.
it's totally different from what you read and see in nursing school. You get black and white in school, but when it came to NCLEX, I was really missing like what it was really all about.
Mm-hmm. Yep. So actually, how many times had you tested? Because you said like after a couple times you realized that something was missing. So like how many times was that after a couple times?
In total I tested 8 times.
Okay.
Yes, in total I tested 8 times, and I believe it was like the fourth time I realized like, instead of taking so long to like get over the fact that I failed, I tried to like figure out like what was it that I didn't do or what was it that I was missing the last time. Like why did I fail? And then when I was getting those reports, I actually listened to something you were talking about with those, the reports you get back from the state and everything like that. I was like, what am I, above here, but then I'm low here. Last time I was low here, but I'm above here. So I wasn't sure what I was missing. So I kind of had to like, reevaluate everything that I was doing.
Absolutely.
Yes.
And I think that is one of the common mistakes is that some students, they feel like just because they failed it, if they just go ahead and retest again, that the results will be different. But if you really don't change the way that you studied, like you will have the same results almost.
Right.
So I have a question here. I kind of can imagine how you felt after failing the exam. But do you want to talk about how you dealt with that failure? Maybe like the fifth time or the sixth time or even the seventh time. How did you deal with receiving the news that you had actually failed the exam?
Okay, so I would say like the sixth time,
Mhm.
when I found out that I failed, I honestly I wasn't as down about it as I was in the beginning, like the first couple times.
Sure.
I did go ahead and try to figure out like where did I go wrong again. And then the seventh time, I was like, oh my God, it was more of like, what am I doing? What are you doing? And I just finally came across like I was going through searching like what else can I try, or like what is it that I'm missing. So I
Mm-hmm.
finally found the ReMar and I started to listen to like the videos on YouTube. I did the university, ReMar University. I
Yep.
was like, okay, this is, I was really like getting into it, and I was like, okay, I wanted to listen to more. I listened to the STD thing from Valentine's Day, and I was like, okay. So
Cool.
I made the sacrifice, and I was like, okay, let me try this. It's least expensive from what I've been paying before.
True.
So I was like, okay, let me try, ReMar. And honestly, it's more different from what I've done before, because it's really like content based. You know, um, Before I would just try to mix questions in with studying, or try to like, I've tried the whole studying alone with questions. It didn't work. But when
Yeah.
I finally, the seventh time, found out about ReMar, I was like, okay, let me try it. And I stuck to the calendar. I went through, I finished 6 weeks, and then I went back again,
Mm-hmm.
about 2 more times through the program until I really understood. And then I was able to like, okay, remember and, really understand it from within. So then I was like, okay, finally. So yeah, the last time I wasn't too down about it. I just said, okay, I need to figure this out. Like,
Yeah.
what is it?
Yeah, so I'm so happy to hear that you did the program more than one time, because sometimes people think, okay, if I go through it, do the 6 weeks, I'm just going to test. And I think you have to evaluate yourself at the end of the 6 weeks to say, am I ready, or do I need to go back again? And it's your responsibility to do that. Like you have to feel comfortable enough to test in the end. And so I'm so happy to hear that you like said, I'm going to go back and do it again, just to make sure that you understood everything. That's such an important step of the studying process. Now, I'm not going to ask you about the actual exam. I know I can do that. But when you were taking your NCLEX exam, did you think to yourself, okay, I'm doing good, I'm not doing good, the questions are coming? Like, how did you feel during the exam?
This time, no, I didn't do that.
Good.
I've done that before where I've heard, okay, if you're getting these kind of questions, you're passing. If you're getting these kind of questions, you're failing. This time I went in there and I was like, I'm not going to do that. I'm not going to be stuck on this 75 or less than 100. Honestly, honestly, I pray, God, please just let me get the questions. If I get to 75, please don't let it shut off if I'm failing. But just let me get questions, and I pray for endurance this time. Like, NCLEX, you really have to endure because you can be sitting there getting questions, getting frustrated, like, oh my God, oh my God. But I really ask God to like help me to endure. If I get the 265 today, it doesn't matter. Just let me take one question at a time. I try not to focus on, okay, this is the kind of question I'm having. No, I just read the questions, chose my answer, went back and read it again, chose the answer, and then I just answered. What I knew, I knew. What I didn't know, I didn't know. So I just went on.
That's it. And that is the perfect mindset. Like every question, just reset. Don't think about what you had 10 questions ago. Don't think about what's coming. Focus on the present. Live in the present. That's what we've been talking about Monday Motivation. Living in the present. How important was your faith during this whole time? Like, because we are a faith-based business. We know that we get our strength from the Lord, and it's such an important part. But for you, I just want to hear talk about that for a second.
Yeah, it's very important. Like, and that's one thing I love most about the program is the fact that Christ is in the midst of everything, and that's how ReMar sticks out from other programs. And like praying, talking to God, not like this whole 2-3 hours, just talking to him, even when you're studying, like, Holy Spirit, I don't understand this, like reveal this to me, just every day, studying, not studying, like just keeping him involved in everything you're doing, especially with NCLEX or anything besides NCLEX. But my faith and my relationship with Christ is the most important thing to me.
Absolutely.
And I always say, even if I don't become a nurse, like I'm still going to be a child of God. Like that's the most important thing. So
absolutely
very important.
What studying advice do you have to give to your fellow ReMar nurses that are watching right now? There's about 200 people right now that are watching you.
Yes, I would tell my ReMar family, those who are studying, to just be positive, be patient with yourselves. Don't rush the program. Take your time. Whatever you don't understand, go back over it. You have time. It's better you take your time than to go and rush and fail again. So just take your time, be patient with yourself and with God, be positive. If you don't understand topic or so, it's your most difficult topic, don't approach it that way. Like try to approach it in a positive way. It'll be easier for you to understand and learn. Be consistent. Don't start, stop, start, stop. You have to be consistent. You have to be dedicated to what you're doing. And just make up in your heart and your mind that this is what you want to do, and you're going to do it. And I mean, you fail sometimes, but that doesn't mean it's the end. Like, failure is not the end. So you'll pass. Everybody will pass. Okay, if I pass, you guys will pass.
Yeah, right?
You'll make it over. You'll cross over.
Listen to Elizabeth. She is giving you guys the advice of the week. Like, be consistent. Don't give up. Keep the Lord in the middle of everything. And she says it like a lot of the other ReMar nurses. If she can pass, you can pass. So very, very good instructions. Yes, listen to her. She is an instructor here now at ReMar Review. She has gone through the challenge and came out on the other side. Elizabeth, one more thing before I let you go. One more thing. What are your future plans now that you have your nursing license? What are you doing?
Okay, so I do have a few interviews to go on. So I'm studying for interviews. You have to study because you don't know everything, but it'll be my first time getting into the healthcare interview type of studying. So I'm studying for those, and then I'll be doing my BSN soon. I
Yeah,
registered, and my goal is to be a practitioner. So the journey is continuing. So yeah,
absolutely.
I have the license, but I'm not stopping. I'm just going on and on and on. So
Absolutely. This is just a small hurdle
right,
in the process. And it's so good to hear that even after NCLEX, you're still studying. That
yeah,
is the reality of it. Like NCLEX is not the end by any means.
right.
Well, thank you so much for joining us today on Let's Talk NCLEX. We talked to NCLEX.
Thank you for
So
having me.
absolutely. We just want to congratulate you. Undoubtedly, you have an incredible story. And thank you so much for being transparent with us and giving us Monday motivation on a Friday to continue on. All right.
Thank you. God bless you guys.
Bye. See you later. So if you guys missed that amazing interview, you will definitely want to watch it again, and some of you again and again, because Elizabeth is a hero in my eyes, and the fact that she did not give up on herself during the interview. She let you guys basically know that she had tried so many different things and she felt like she was still missing that one thing. So I'm glad that my girl found the DVD self-study package to help her on her journey to being a nurse. Whew. It is an amazing resource, pulls it all together for you. That was the goal of the program. So this is Let's Talk NCLEX. Let's get to our NCLEX question of the day. It is this right here. A client begins to choke while he is eating his breakfast. His face turns bright red, but he is able to cough. Which of the following is the initial action of the nurse? Here are our choices. Jude, I see you passed your NCLEX. Congratulations. Here's our choices. Number 1, administer abdominal thrusts. 2, perform back slaps. 3, perform finger sweeps of the mouth to remove the food. Or 4, encourage the client to take small sips of water. So essentially, you have a client who is at the eating area. And this is the thing about NCLEX questions. It doesn't matter where the patient is, what they're doing. Essentially, you have a client who begins to choke while they're eating, right? And they're experiencing some distress because you see that their face is changing colors. So the face is turning bright red, but the patient is able to cough. So what is the first thing that the nurse should do in that situation? All right, here are choices again. Administer abdominal thrusts, perform back slaps, perform finger sweeps of the mouth to remove the food, or encourage the client to take small sips of water. Go ahead and put in your answers. We're looking for the very first thing that the nurse should do in this example. We got a lot of answers on our Facebook page. Thank you guys for participating so much on our Let's Talk NCLEX post. However, the answers were not consistent. They were all over the place. So we wanted to make sure that we tie up the loose ends on patients who are choking. So I see the answers 2, 4, 1. 1, people are picking give those abdominal thrusts, perform the back slaps, just help them, hit them on the back a couple times. And then also 4, encourage the client to take sips of water. They all sound really good, but only 1 is the correct answer. And that correct answer, without further ado, is hit it. Encourage the client to take small sips of water. You were a little late on that cue, but it's all right. We're going to encourage the client to take small sips of water. Some of you guys picked that one, but remember, listen, this was the most appropriate thing to do. And let's just review some choices here. If a patient is choking but they're able to produce a cough, then that means actually that they can breathe. Because if you're coughing, then you have an open airway for air to come out of. There is some opening going on. So the reason why you would like the patient to take small sips of water is because when that happens, it can actually help to further assist the patient to open up their airways. Now, if you, there's no need to do abdominal thrusts at this point. Okay, that would be if there was a full blockage, the patient was choking, they're not able to make a sound or talk, then you would do the abdominal thrust, the back slaps even perhaps, but that would not be appropriate at this time. And sticking your finger down to remove food is a no-no, because what it can further do is push food into the wrong position. So we definitely would not want to do that. All right. So this is a basic safety question, which we know that NCLEX is all about client safety. So being able to identify points where it seems like it's just common knowledge, but it's really not. It's training to be able to do things in emergency situations. But we must make sure that we review these things when we're talking about NCLEX, because if you pick something other than the correct answer, then that demonstrates that you may not be a safe practitioner. Okay. And that's something that we don't want to do. So we're not going to end there. I have some more review on this same topic. Let's look at this question. Are you guys ready for it? Here it is. A nurse is performing the Heimlich maneuver. A nurse is performing the Heimlich maneuver. After she places both arms around the client's waist, she makes a fist with one hand. Okay, and that's what you're supposed to do. Place the arms around the waist, make a fist with one hand. Which is true concerning the position of the thumb? All right, but which is true concerning the position of the thumb? Here are the choices. You got it? Okay. Which is true? The thumb is placed inside the fist, or the thumb is placed outside of the fist? The thumb is placed inside the fist, or the thumb is placed outside of the fist? All right. So, what do you guys say here? Is it 1 or 2? Okay, see some people saying that thumb should be on the outside of the fist for sure. And some people saying the thumb should be on the inside of the fist. This is really like, it's like, oh man, I know this. I'm sure one of my nursing instructors told me this when we went over, CPR, the Heimlich maneuver, but I really don't remember it. And this is the kind of stuff that NCLEX sometimes will just get you on, because it's like, do you know the fundamentals? Do you know the content? And this is a situation where strategies really don't work. Like if you have a decision tree, I don't really know how you will be able to get to the right answer, because it's essentially you either know it or you don't. So the correct answer is that thumb should be placed outside of the fist, outside of the fist. All right. Did you get it right? Did you get it right or not? People like, yeah, I had a 50% chance of getting it right. I got it right. All right. We are going to keep on going. I got another question. This is the same thing. Here we go. All right. When doing the Heimlich maneuver, how many abdominal thrusts should be applied to the client? How many abdominal thrusts should be applied to the client? Number 1, 3 to 4, 2, 4 to 6, 3, I'm going to do 6 to 10, or 4, 15. 15 abdominal thrusts should be applied to the patient. Can I get an answer? Can I get an answer? What are you going to do in this situation? you got to pick one of these. You got to pick one of them. But this is a life-saving intervention, the Heimlich maneuver. You don't want to do too few. You don't want to do too few in this situation. So I know people are like, I don't want to hurt the patient. They definitely need you to be persistent when you're doing these abdominal thrusts, because it literally, you're trying to open up an airway. So what do you guys say? 3 or 4? 3 or 4? You have the 3 or 4. Okay. All right. If you think 3 or 4, but you have to get into a rhythm. You understand? You have to get into a rhythm when you're doing these. I wouldn't do 3 or 4. Check my notes here. And we're going to try this again. The correct answer is, hit it. A little bit like better this time. 6 to 10. 6 to 10 is the goal. Number 3, it is the goal to lift up the diaphragm. And literally, you're trying to produce a cough where there is not a cough. Okay. So you're trying to make the body forcibly expel whatever is lodged into the airway. Okay. So you need at least between 6 to 10 abdominal thrusts to do that. And I'm telling you, the patient that you're trying to do it on will be extremely grateful if you don't give up after 3 or 4 times. All right. After 3 or 4 times. So it's interesting. We're learning here. Now, usually I stop, but if you guys follow me on Instagram, which you should, you know, I also put up Let's Talk NCLEX questions on Instagram that are picture related, right? And follow me on Instagram right now, because we also do secret sales on Instagram. Like for this week, we gave 25% off the Quick Facts book with a code on Instagram, which was ReMar IG. So if you know about our Instagram page, then you know that we had a little secret sale there. All right. So I'm going to do the question from Instagram here on Facebook as well today. So here is the question. Looking at the picture, because this is a picture. Here we go. Which of the following is the most likely diagnosis? 1, chickenpox. 2, herpes simplex virus. 3, rubeola. 4, oral erythema multiforme. Or 5, epithys stomatitis. Yes. What saith you all? What saith you all for this question? Look at the picture and give me the diagnosis. Look at the picture and give me the diagnosis here. Is it that easy? Is it easy? Are the questions on Instagram easier than the ones on Facebook? I don't know. I think because it's a picture, or you guys are really studied up. Like, I warmed you up. The correct answer, of course, you guys got it. Of course, this is herpes simplex virus. But look, check this out. A lot of people on Instagram didn't get this one right. But this, of course, is going to be herpes simplex virus. It is localized. We have it here localized around the mouth, which is usually what you see. And I went on to talk about the treatment and the usual duration of the herpes virus, but how medications really can help cut the severity of the symptoms, and also how long you will have herpes simplex type 1. I want to remind you guys that I did do an advanced study session on STDs. Check out our YouTube page if you want to see that pregnancy and STD advanced study session. I think it'll be super, super helpful for you guys that maybe didn't get it right, or know that you want to study more. So that was the Instagram question of the day. I have to go over the newest segment that I added to Let's Talk NCLEX, which is essentially more questions that I get during the week. Like when students email me questions about NCLEX or just educational things about nursing, I'm going to start sharing them with you guys here because I think they will help the general community. So this is the Ask Regina segment. I'm going to try to take some questions, but I also have some prepared for us today. So the first question that I want to hear that I got was, I'm curious to know if LPNs do not touch IVs in the NCLEX world, then does that mean that there will be no IV drip calculations on the NCLEX exam? So I thought this was really helpful because essentially a nursing student was asking me, hey, how much math do I have to know? Do I have to know drip calculations? And the only thing that I could do to alleviate this concern was to actually show what I got from the test plan. So in terms of IV therapies and pharmacological therapies, this is what you're expected to know for your exam if you're taking the NCLEX PN exam. And this is up to date. So if you look at the fourth bullet point, it says calculate and monitor intravenous flow rates. So that means that for the exam, you are expected to be able to calculate how much IV fluid that your patient is getting. You also should be able to determine signs of inappropriate infusions or be able to identify congestion, I should say systemic congestion, pulmonary congestion, if a patient is receiving too much IV fluids. So let me see, a math tip for you guys. When it talks about knowing the flow rate or calculating the flow rate is essentially the number of milliliters of fluid that your patient is getting per hour. So you should be able to determine that. For example, if it says your patient is supposed to receive 1 liter of fluid over 10 hours, how much fluid should that patient get every hour? So an example would be 100 milliliters per hour or 80 milliliters per hour. Like, you should be able to break down how much fluid a patient is getting per hour if you are taking your NCLEX PN exam. Now, we know the RNs, you have a little bit more to do with the math, but for NCLEX PN, definitely don't shy away from being able to perform basic calculations. Now, I have already done a math review for you guys. Okay, I've already done a math review for you guys, and I want to direct you to it. I did an advanced study session on math, and this is can be found on the ReMar YouTube channel. Okay, so ReMar YouTube channel is called Nursing Math, and there I go over the very basics of nursing math, but I also touch on the calculations that you need to know. So over the weekend, if you have time, go ahead, do yourself a favor, watch that advanced study session. I think it'll be super helpful. I should have asked if Elizabeth got a chance to do that with me, because the things in that advanced study session are not in the DVD package. So that's new information for you guys to check out. And that's one of the benefits of ReMar Review, is that I'm able to give you guys new information all the time by way of things like Let's Talk NCLEX, advanced study sessions, Let's Talk Nursing. And it's just a really cool way for us to stay current on our NCLEX information. All right. Another question that I got this week was basically, hey, Regina, I'm studying in your DVD workbook. Which vital sign is the top nursing priority in a normal newborn infant? Wow. All right. So which vital sign is the top nursing priority in a normal newborn infant? We have number 1, temperature, 2, heart rate, 3, respirations, and 4, blood pressure. What do you guys think? Maybe some of you don't have the DVD package. What do you think is the top vital sign in a normal newborn? Temperature, heart rate, respirations, or blood pressure? Elizabeth said, I did go over the advanced study session. Thank you. See, I love that. You put a question out, you get an instant answer. Perfect. So heart rate, everybody's saying heart rate, what? 3 respirations. I said a normal. I said a normal newborn infant. A normal newborn infant. Okay. So the answer is going to be temperature. Temperature. Remember, babies have a very hard time keeping themselves warm when they're born. So what happens when a normal newborn is born? The first thing we do, what do? We put a hat on them. We wrap them up in blankets. We swaddle them. We put them in a warmer. Babies have a hard time keeping their body temperature at a normal level. So temperature is your concern for a normal newborn infant. All right. Okay. So let's talk NCLEX is complete, but I saw some questions. As we were broadcasting. And so the first thing is somebody asked, how do you use the boot camp? And the ReMar Review Boot Camp is another free resource that you're able to use in companionship with a product that you have. So for example, if you purchase Quick Facts, or more appropriately, if you purchase the entire program, then you go to the website, remarreview.com, and you buy, it's free. You go to the website, remarreview.com, and you sign up for the boot camp. And it's a little box on the website that says ReMar Boot Camp. And it has like Army fatigue on the picture. And when you sign up for that boot camp, then you will get additional information to help you study along the journey of the 6 weeks. So every Monday, you'll get an email from me, and it'll say, have you done this? You should be up to this point. Here's a quiz. Here's a quiz from Quick Facts, or here's a quiz from the program. And so it just helps you to be accountable for where you're supposed to be based on the calendar. So it's been a really helpful resource. Again, it's something free that we provide. People asked, I think somebody posted on the Facebook page this week, do you have any free things for people who can't afford the program? Oh my goodness, do we ever? Most of our resources are free. So the Facebook Lives that I do, the ReMar blog, the YouTube channel, the boot camp, these things are all free that we provide for you guys to get you acclimated to how we instruct here at ReMar and how we do things differently. So that is one of the things. So Akeisha says, I'm fearful for new version of NCLEX. How will we learn with new format? Don't worry about it. I got it for you guys. I'm telling you, I will explain to you guys in detail what are the changes and how we're going to prepare for it. I have to probably do a whole nother, I probably will have to do a whole separate broadcast for that NCLEX. But don't be afraid of it, because literally those changes are not happening until April of 2019. Nobody on this broadcast should be taking that new exam, because you have months and months and months to take the current NCLEX. So don't even worry about that, because you can by then already be working as a nurse, because you already took your exam and you have a job. All right. So don't even worry about that. But for those of you that just want to know, I'm going to tell you, of course. All right. Okay. So I think that's all the questions. I see a lot of comments. Continue to dialogue amongst yourselves. I see some good things in here. So Let's Talk Nursing will be coming up again next week, and another Let's Talk NCLEX question on Facebook and Instagram for next week. I will be back for our Motivational Monday. Jude, I saw you pass your NCLEX exam. I want to see your video testimonial. I'll be sharing the one that I got this week. I'm really excited to share and just talk about the nurse. It was a great video. So continue to study. I want to leave you guys with one thought before I go. It is this: as we go into the weekend, yes, sharing is caring. As we go into the weekend, the word fear has two meanings. It can mean forget everything and run, or face everything and rise. Face everything and rise. So I want to challenge you. I want to challenge you guys with that thought this weekend as we depart from our live session until we meet again on Monday. I want you guys to go into the weekend with a mindset that you're going to rise to the occasion and you're going to solidify yourself in the positive thinking and reaching after your goals, because you absolutely can do it. I hope everybody who saw Elizabeth today is encouraged and motivated by her amazing testimony, despite many challenges and many excuses and reasons to give up. Nurse Elizabeth decided to face everything and rise, and now she has a new life because of it. So what will your story be? What will your testimonial be? Whatever it is, we're going to congratulate you and be happy. As our 2018 class motto goes, we can, we will, we must pass NCLEX. We can, we will, and we must pass NCLEX. I want you guys to have a very blessed and safe weekend. I will see you guys Monday. Later.